very safe for myself and for my workers as well. You know, you can't assist people while you are in danger. For example,
True.
if you are in the ring road, it is 80 km/h, isn't it? At the middle of the road, maybe there may be a victim. If you try to assist him, if you try to stop the bleeding, if you try to, you know, breathe for him at the middle of the road, another crash will come to you.
Well, you told us that we are the worst of drivers. Yeah.
Yeah. So that, you know, we need to be safety to self. It's a very important principle of first aid. Then after a while, when I reach there, the ambulance has to be parked as according to the principle. You know, if the crash happened and if you go there and to try to stop the ambulance there, the other crash will come to you. Right. So that you have to siren, you have to show light.
This is the normal procedure.
Yeah.
But like, give me an example. For example, you said you support pregnant women.
Yeah.
You know, that's something to do with delivery.
Yeah.
And you have a road accident which is related to that. How do you handle that? What guide us into the interior of your ambulance? What do we expect to receive in terms of treatment, first aid treatment, before you get to the hospital?
Yeah.
Is it a standard service that one gets, like what we see in the West?
No. It is very difficult to compare when you start. You say
let's not compare it.
Yeah.
Let's just give me.
But we need to be, you know, we are trying to come up with the standard, whatever little resource that we have. For example, in my ambulance.
Besides the driver, who else is out there?
Nurses are there.
How many nurses in an ambulance?
In every ambulance, one nurse will be there. One nurse, one paramedic who took a training, you know, to be a paramedic, and one driver will be there automatically. Then, when they reach the accident, as I said, after they confirm that they are safe, they will see the area. Then how can we assist? What is the case? And immediately, when they reach there, they try to know whether the person is saturated or desaturated. That means, did the victim have sufficient oxygen in his blood? This is very important and very simple. We don't have to make it sophisticated. You know, if you put somebody's finger here, you know that the person is saturated, have oxygen in his blood or not. Immediately after you know this, there will be 100% oxygen in my ambulance. From the scene of the accident to the ambulance, there is a portable oxygen. From the in the ambulance, there is a fixed oxygen, so that the person will immediately get oxygen, because within 3 minutes the brain will die without oxygen. This is something that we need to act
upon first.
Absolutely. Then in the ambulance, every treatment will be there.
Like?
We can secure IV line. If the person is in shock, we can put him in shock position, because the stretcher is so flexible that we can put in any position. Position is very important. And we have a spinal board if he's in crash. For example, we have a neck collar to protect. This is the center for respiration and circulation. Unless and otherwise you protect this, then you make the person to end up in paralysis and in disaster. We are very much concerned about the center of respiration and circulation, so that we put some neck collar around it. We don't. For example, we have a plan to give training. We don't need to have a standard material, but with whatever material we have, we need to know that this need to be protected.
Why
we
not
don't have to move.
Why not standard material? I mean, if you are actually working on such kinds of intervention and you come first in doing that, you have to be first in everything else.
Yeah, I am. But you know, after the crash, they may wait for the ambulance. Still, the ambulance happened to the scene of the accident. Those like traffic police, drivers, or anybody else there should protect this, whatever material that they have, and should not let the patient move so naughty that they can let him end up in incontinent in his life. So in paralysis, so that the spinal cord and the brain should be protected till it is confirmed by the specific physician or specialist in the hospital. We don't have to be a specialist to know this. What we have to do is we have to protect the person at the scene of the accident. It is our job, our exclusive job to do that. Then after, the specialist in the hospital will say that no, there is no crash around, there is no trauma around here.
So how well trained are your nurses to be able to handle this on the site of accident?
Yeah, you know, I have an experience to give training for the United Nations WFP staff since 2000, touring around Ethiopia in 16 places. Every 2 years I just deliver that 2 days training, sometimes 3 days, sometimes 2 days training for those staffs. Then I also have some experience in delivering the first aid and health safety training for British Embassy and other embassy in Addis Ababa. So that whenever I have a training, these people should know how we are just giving the training, and they will receive the training at the same time. And they were in an international training which is conducted by Tebita, my organization, and INAPA, Ethiopian North American Health Professional Association, and capacity building, as well as Addis Ababa Health Bureau, and they were in that big intensive training. So that this training, by the way, is not one-time training. We need to take a lot of training to cope up with the current situation of our country, because we are, as I said, in the top in the global list of road traffic injury.
Yeah, the reason why I've raised that question is simply this: you're dealing with an emergency. You're trying to act in emergency situations. Of course, you know the hospital is always emergencies, of course, but we're talking about road accidents. Yeah. And situations like that, in emergency cases. How well prepared are your nurses to be able to do that?
They are well prepared, because, for example, if the pregnant lady, their position is at the end of when she's at the end of her gestational period, she needs to lie in the left lateral position. She needs to have oxygen when the baby is suffering against lack of oxygen, to transport from one hospital to another hospital, because this hospital may not functioning. She may move to the other hospital. When she's moving to that hospital, she needs to be with the standard caring, so that our nurses are, I can say, well trained about the topic. But they need to have very frequent training about it to be a full paramedic. We only take the first training now. We need to have 4 training, at least, to cope up with the current situation of paramedics.
But there are cases in which people died where you're giving them treatment, right? Where you're trying to save their lives, right? There were cases like that.
Yeah.
So is that the lack of preparation, the lack of training, or is it because you came late into the scene of accident?
Not as such, but you know, one day we transport one patient from one hospital to the other hospital. When he reached there, he was desaturated. His oxygen level was so low that they were actually supporting him, but it is a clinic, so that they need to transfer him to the hospital. And we actually transferred him to the hospital. After he reached the hospital, within 15 to 20 minutes, he died. You know, it was kidney failure. Sometimes whatever action that you do, it is impossible to save life, because some of the diseases are very chronic disease, and your assistant. We try to transport some 200 patients within the last 3
months.
3 months, and most of the cases were from hospital to hospital, because, as I said, it is really it needs some sort of multi-sectoral approach to the scene of the accident, especially from road traffic injury point of view and from the pregnant woman. We are dealing with the different stakeholders concerning the topic, but you may face days in the ambulance even.
That's very interesting. You try to save lives in the streets, you know, where there are accidents and so on, but okay, you take them to one of the hospitals. Let's say Black Line Hospital. There are already several cases that require immediate attention. Why would you be so special?
This is a very critical